This is David, and this is David's story. David was born in Yorkshire, England in 1937. He was the first of his family to attend university and studied medicine. As a medical student, David met Nancy, who soon became his wife. In their first years of marriage, David was working as a junior doctor in England. David and Nancy did a lot of travelling together. They soon had 3 children, all girls named Helen, Rachel and Kathy. They travelled all together by boat to Australia in 1965. David's first job in Australia was in Omeo. They moved on to Bairnsdale, where David spent the bulk of his practicing career. In 1985, David wanted a change and worked at the Commonwealth Medical Office in Canberra. David also completed occupational health training. He was then offered employment overseas with the Australian Embassy in Beijing, which became the start of his and Nancy's big adventure. This was followed by another 3 years each at the Indonesian Embassy Clinic in Jakarta and the Laos Embassy Clinic in Vientiane. In the year 2000, they moved back to Canberra, retired and commenced their grey nomad adventure around Australia in their caravan. David and Nancy were loving life and retirement. After their travels, they sold their house in Canberra and moved back to Melbourne. In 2015, Nancy was starting to show some cognitive decline, which ended their travels. This was when Henry came into the picture. Unfortunately, Nancy's decline was rapid. She went into care in 2018 and died shortly after. David wasn't managing in his big Melbourne house, and his daughter Helen was worried. He had been having a few small car accidents. They both moved to Creswick in 2020 after finding an independent living unit for David. David loved his walks with Henry, but he was often calling Helen, informing her that he was lost, or he was being found and rescued by Creswick residents. Evidence was now showing of David's cognitive decline. David had become virtually blind in his left eye in 2003 after an episode of acute central vein thrombosis. Then, in 2020, David became legally blind in both eyes after experiencing acute glaucoma, where the pressures became catastrophically raised. 2 surgeries were unsuccessful. One day, David and Helen went to the Creswick market, and David informed Helen he was heading to the pharmacy. Helen waited for him at home, but he didn't arrive. Helen later received a call from the emergency department. David was picked up via ambulance and transported to hospital for a head injury. Post this, he was transferred to Creswick Hospital for TCP, but he discharged himself and went home. When home-based TCP ended, David no longer had enough support, and one day he called Helen to help. He was lost in his own bedroom. Helen was able to get David into a facility in Creswick for emergency respite. He was settled for a short while, but then he was having episodes of delirium with multiple falls and lots of calls and stress to Helen. It was the beginning of the year in 2022. Helen and her sisters were very concerned for David's health and well-being at this time. He was covered in bruises from all of the falls. A desperate call was made to Creswick Aged Care, where he had been on the wait list for some time. To Helen's enormous relief, a bed was made available and David moved that same day. It was evident at this time that David had a severe cognitive impairment and he was having a lot of difficulty comprehending what was real and what he was making up in his mind. Not only is David legally blind, but he is also deaf. Staff worked hard to try and understand David's behaviour and the struggles he was clearly facing. David was diagnosed with florid psychotic phenomena. David has had multiple medical and geriatrician reviews and now is on a medication regime that helps David find some clarity in his environment and his surroundings. Staff have learned his triggers and attempt to attend to his needs promptly. All David really wanted was his number 1 boy, Henry. Helen bought David a plush dog and instantly David said, "Oh, Henry, my boy, I love you." And he started patting him and cuddling him. Helen and the staff had tears in their eyes. It was such a beautiful moment.
Henry is my favourite boy. I dote on him.
David loves his family. This is his daughter Helen and two very loved family dogs, Maud and Bailey. But still, no one compares to Henry. Henry will always be David's best friend. Unfortunately, Henry died late last year, but Helen does not wish to tell him this, as he still believes he has Henry with him and he gives him so much comfort. He doesn't leave David's side. How old is Henry?
Old enough to know better.
In David's own words over his time in Creswick Aged Care. I have had a wonderful life. I was known as Dr. David Hanson, and I travelled the world for my work, all alongside my beautiful wife Nancy. She and Henry were my world and the loves of my life. Nancy died a few years ago now, and it makes me very sad. I wish to be with her. I am blind, I am deaf, and I have dementia. I get very confused, and I know sometimes I yell a lot or I am being loud. I get very frightened and angry because I cannot make sense of the world. I have lost the ability to walk without your help, and most of the time I crawl around on the floor to get around. David sometimes tells staff that he is on a boat and he can't get off. Other times he may feel like he is on an aeroplane or a bus. Not always, but most of the time now, staff are able to describe his environment and reassure him that he is on a flat surface or he is in his bed. What matters to David at different times? Henry is always number one. David loves his wine, whiskey, coffee, chocolate, cake, going outside, and loves company and sharing his stories with his family and staff. David was offered a shower one day. I would love a bath, he said. And one day, David said he would love to play the piano again. So he did.
When I was a kid, all the piano tuners were blind.
Were they?
Something they could do, Now, what's an easy tune?
In Helen's words, Dad has received lots of love and care from staff, and you have all made a big difference to his life. Dad now has more good days than bad days. The disease is steadily progressing, however, and this may change. Helen and her family are so grateful that David now has some quality of life and they are able to share some of these moments with him. This is Kathy, David and Henry out for a walk together. David's moments of clarity have provided opportunity for him and Helen to discuss his end-of-life choices and clarify his wishes. This is Rachel and David's good friend Ian visiting David for his birthday this year.
Birthday to you. Happy birthday to you. Happy birthday, dear David. Happy birthday to you.
Yoo-hoo!
Hooray!